Hi everyone, and welcome to the third in the series of the LSN's Ask the Expert videos. I'm Anita Wallace, Chair of the Lymphedema Support Network, and I'm delighted today to introduce you to the LSN's nurse advisor, Denise Hardy, who runs a very busy practice in Kendal, and she's very, very experienced. So I'm delighted that she's agreed to come on with us, and we'll get going on the questions. So this question is, what is the best moisturiser to use?
Yeah, I mean, at the end of the day, Nita, it really depends on the skin condition that you come across. Most people, most women anyway, look after their skin these days, and that's ever helpful for those with lymphedema, because our aim is obviously to keep the skin in as good a condition as possible, because we want to reduce the risk of cellulitis. So essentially we want to keep the skin soft and supple, stop it drying out. And whatever does that, I'm happy with, really. So if somebody comes to clinic and says, and they've got really good skin, and I say, oh, what do you use? And they say olive oil, I don't care, that's great. It works for them. And I'm happy for people to use, what they're happy to use. I do like organic coconut oil. However, it's very greasy, and it's more like an ointment, which is helpful for those with very, very dry skin. So that can be, one of the recommendations I would make. But essentially, it's looking at the skin condition and recommending an ointment if it's very, very dry, versus a cream if it's a little less dry, and then a moisturizer, which is more of a lotion, which is the most popular because it's more better absorbed. There's more water in it than anything else, so it sort of evaporates. But there's all sorts of things that are recommended, and again, our fact sheets go through a huge list of those.
Yes, they do.
One of the things I do like, though, is a spray moisturizer for those the elderly who find it difficult to reach their toes, for example.
Yes, that's very true.
So there is a product, and there are many more available, but things like this Emolin spray, and that literally you can just spray it down. And this is a mixture of white paraffin and soft Vaseline, and it just sort of spread. You can literally aim it anywhere, and you can reach areas that they can't possibly reach. So I like that. Aveeno is another one that I quite like.
I have to say Aveeno is my favourite, and that's what I tend to use.
That's, again, comes in a lotion as well. So that's good.
Yeah.
Again, for those that can't reach areas, then again, a long-handled roller. I mean, this is a short one that we use for head and neck patients and breast edemas. But for those who want to reach their toes, you can get long-handled radiator rollers. And you can just put a spot of cream onto that, or lotion on that, and you can easily reach, areas that you can't perhaps bend down to reach. So those are things that I really like to think about with patients, because some of ours live alone and they haven't got people to help them apply.
No, I'm thinking of my friend's mother, actually, who's in a care home. I think that should be a tip we put in the next newsletter, Denise. I think that's excellent.
Yeah, it's a really good one to help with that. And they're available in those, those aids for the elderly. There's really great booklets in there, and I've picked all sorts of good tips up in there for people. So it's well worth looking at the mobility shops that you've got dotted around most towns these days, with the scooters sitting outside and things. But they have really good gadgets like this, and that can be really helpful. So yeah, those are the sorts of things that I'd be looking at. But in regard to my favorite, I don't have a favorite, really. It's what suits the patient and that particular skin condition that they've got at the time, and whatever works for them, I'm happy with, really. So that's
I suppose basically, depending on your skin condition, if it's particularly dry, then you need to use a heavier duty ointment.
Better, or
and then you can step down to the cream and then the lotion as your skin condition improves.
Exactly. And I think also bearing in mind when you're showering, not to use an ordinary soap, because they do dry the skin as well.
They do.
So things like aqueous cream can be used as a wash, or it actually comes in a tablet form now that you can use. So those sorts of things are great to use and stop the skin drying out in the first place. And of course, as we get older, our skin gets dry. So, you know, it becomes even more important for those of us who are getting old and wrinkly.
Okay, lovely. Thanks very much, Denise. Thank you.